All right, everyone, welcome back. Get ready, because today we're going deep on pneumonia.
Pneumonia.
Yeah, but not just any pneumonia.
Right.
We're talking about the kind you pick up out in the world.
Community acquired.
Exactly. So picture this. You're about to walk into rounds. Maybe you've got a big exam coming up.
Oh, I remember those days.
And you need to know.
Need to know.
Not just the names of the bacteria.
No way.
But the clues.
Clues, yes.
The things that help you pinpoint what's really going on with a patient.
Absolutely. Like a medical detective.
Exactly. Like a medical detective. So we're going to break it all down, all based on a recent lecture for doctors prepping for those tough exams.
So you're getting the inside scoop here.
Exactly. Insider info. Now, before we get into the specifics,
Okay.
just a super quick reminder. Community-acquired pneumonia. This means you didn't get it from being in a hospital.
Right. Not hospital acquired.
You picked it up,
Out and about.
living your life,
Yeah.
going to the store, walking down the street,
Exactly. Going to work.
go to work. And there's a whole cast of characters, right? A whole bunch of different bacteria that can cause this.
A whole rogues gallery.
But we're not just going to give you a list of names and symptoms.
No.
We're going to talk about how they work, what makes them tick, and what clues can point you in the right direction.
It's about understanding those connections.
Okay, so first up, Haemophilus influenza. Tricky name.
Yes.
It makes you think of the flu. But this is a bacteria.
That's right. Not a virus.
And it has a really interesting connection to COPD.
Yes, it does. So you see, with COPD, those airways are already damaged, right?
Chronic obstructive pulmonary disease.
Exactly. The lining of the lungs gets all messed up, and it's almost like it creates these little entry points.
Like a weak spot.
A weak spot, exactly. And Haemophilus influenza, well, it can take advantage of that. It's sneaky like that.
So it's not that COPD directly causes pneumonia, but it makes it easier for something like this to take hold.
Precisely. It sets the stage.
Gotcha. Okay, now, Staphylococcus aureus.
Oh, Staph aureus.
This one is infamous, right? For hitting you when you're already down.
Oh, yeah. Especially after a virus, like the flu.
Why is that?
Well, think about it. When you have the flu, that virus is attacking your respiratory system.
Right, your body's already fighting.
It's already fighting hard. And the virus can really disrupt your immune defenses.
So your guard is down.
Guard is down, and that's when Staph aureus, it sees its chance.
It swoops in.
It swoops in and takes advantage. It's like the flu weakens the fortress, and Staph aureus is right there ready to storm the castle.
It's like a 1-2 punch.
Exactly.
Okay, now this next one is interesting. Klebsiella pneumonia.
Klebsiella. Now this one
seems to have this thing for people with alcoholism or diabetes.
it does seem that way, doesn't it?
Why is that? What's the connection?
Well, we know that alcohol can really suppress the immune system. It makes those lungs more vulnerable.
So it's not fighting as well.
Not fighting as well. And with diabetes, high blood sugar, well, that can actually create a really cozy environment.
For the bacteria.
Yeah, for bacteria to just hang out and multiply.
So it's almost like those underlying conditions.
They're almost like risk factors.
Yeah, making you more susceptible.
Absolutely. It's a reminder that sometimes an infection is a sign of something else going on.
You got to look deeper.
Always look deeper.
Okay, let's move on to anaerobes. So these are a bit weird, right?
And anaerobes, oh yeah, they're fascinating.
They like to live where there's no oxygen.
They thrive without it.
But we need oxygen. Most things need oxygen.
Well, most things, but not anaerobes.
So how do they survive?
They've got their own special ways of getting energy, different metabolic pathways. It's amazing what they can do.
So where do we see them causing trouble with pneumonia?
Well, they're often involved in aspiration pneumonia. Have you heard of that?
Aspiration. I know that word.
Yeah, it's when something besides air gets into the lungs.
Like if you accidentally inhale something.
Exactly. Could be food, liquid, even vomit.
That sounds unpleasant.
It can be very serious, especially for people who have trouble swallowing.
Makes sense. So why is poor dental hygiene a risk factor here?
Because your mouth, it's a bacterial playground.
Oh, I don't like the sound of that.
And a lot of those bacteria are anaerobes. So if they get aspirated down into the lungs, that's when you get problems.
So take care of your teeth, folks.
Absolutely. Brush, floss, the whole 9 yards.
Okay, moving on. Mycoplasma pneumonia. Now this one is a bit of a head scratcher
Why is that?
because it tends to affect young, healthy people.
Ah, yes. Mycoplasma, the walking pneumonia bug.
Walking pneumonia.
Yep. That's what we often call it because the symptoms can be pretty mild. You might not even realize you have pneumonia.
Interesting.
You could be walking around, going about your day, feeling a bit off, and bam, it's mycoplasma.
Okay, Chlamydophila pneumonia.
Chlamydophila.
This one I've heard has a connection to hoarseness.
You've heard right.
Really? Yeah. So this bacteria, it can actually infect the larynx, your voice box. So that's what causes the raspy voice.
That's it. It's like a little alarm bell going off in your throat telling you something's not right.
That's a good way to think about it. Now, Legionella.
Ah, Legionella. This one gets a lot of press.
It does, and it's usually tied to outbreaks.
Right, because it's often linked to contaminated water sources.
Water.
Yeah, things like cooling towers, hot tubs, even those fancy hotel fountains.
So it's not something you catch from another person.
No, it's from the environment.
Interesting. So you could be perfectly healthy.
Yep, and then boom, you encounter some contaminated water.
And that's how you get sick.
It's a reminder that our surroundings can play a big role in our health.
Makes sense. Okay, Chlamydia psittaci.
Now, this one is a bit more specialized.
This one always makes me think of parrots.
Well, you're not wrong. It's mainly found in birds. Parrots, pigeons, poultry, all sorts.
So you're more likely to encounter this if you work with birds.
Exactly. Veterinarians, poultry farmers, people like that.
So your job can put you at risk.
It definitely can. And last but not least, we have Coxiella burnetii.
Coxiella.
Yeah.
Another one connected to animals, right?
This one is particularly interesting. It's linked to animals giving birth.
Giving birth.
Yeah. The bacteria can be found in amniotic fluid and the placenta.
So farmers, veterinarians.
Anyone who works with livestock, especially around birthing time, could be exposed.
It's amazing how many different factors can come into play.
It's like a puzzle, isn't it?
It is. We've covered so much.
So much.
I mean, it's just fascinating how these infections,
Seemingly straightforward infections.
seemingly straightforward, right?
Yeah.
They can be so complex.
And understanding the details,
The details.
that's what helps you make the right diagnosis.
And give the best care.
Exactly. It's about connecting those dots, thinking like a detective.
It really is. And this is just a starting point.
Oh, yeah. The learning never stops in medicine.
There's always new research, new discoveries.
New challenges, new pathogens.
So stay curious out there.
Stay curious.
Keep asking questions.
Never stop learning.
That's how you stay ahead of the game. All right. Thanks for joining us for another deep dive.
It's been a pleasure.
Until next time.
If you like the video, please hit the like button and subscribe to our channel to see more of this content. And while you're at it, share it with your friends.